you, or welcome back to the Movement Driven Podcast. I am joined by a very special guest, my neighbor here at the Elite Wellness Center, adjacent to CrossFit Tailwinds, our newer location. This is Maggie Mahany, and she is a mental health counselor. And so, Maggie, tell the people a little bit about you. Tell them about TheraFit, her company, and like what you specialize in, all that good stuff.
Perfect. My name's Maggie Mahany, like Greg said. I'm a licensed mental health counselor. I'm an L2 CrossFit coach within CrossFit Tailwinds as well. I've been a counselor now for going on 5 years. I'm also a qualified supervisor, so I take students on as well as they're starting to go through their pre-licensure. Like what I like to treat, it kind of ranges. I like to kind of be really dynamic. There's a lot of different things. Going traditional therapy route, I'll pretty much treat from 8 to right before a geriatric population. And then that can be your everyday person that is talking about depression, anxiety, PTSD, trauma, relationships, couples counseling. And then from there, I'll also take some athletes, whether that's adolescent athletes, professional athletes, doing some more of the sports psychology basis, and less of the traditional like talk therapy.
That's awesome. And so what I find most fascinating, you mentioned to me before that you do a lot of adolescents and you work with athletes as well. So talk a little bit about like what do you enjoy about working with that population first or else? And then like how do you take an athlete through that's maybe dealing with, like you're saying, the general anxiety and depression and some of the things that I guess most teenagers have to deal with, but also like beyond the field stuff. We'll get into that too.
Yeah. The cool stuff about working with athletes, especially in the adolescent range, is we're seeing so many different things that we used to see a little bit later in a lot of athletes, right? Because kids are getting more involved in more competitive sports and more like travel teams and higher level competitions at a younger age.
Yeah, like they're specializing soon.
Yeah. And they don't really know, I don't want to say they don't know about their emotions, but they don't know how to deal with like the big emotions and the anxiety, and not winning a race or a competition can be really tough and difficult. And then feeling guilt because we didn't practice this hard last week, or we had that sleepover with a friend sometimes comes up, and we're thinking that that's, the little dip in performance. I think that athletes that are adolescents have really good relationships with their family and really good relationships with their coach, but they don't have really good relationships with themselves because they don't know themselves yet.
That's interesting because like as you're talking, what pops into my head is like the culture around youth sports. And this was even a problem like when we were kids, but it seems to be more and more so of the parent kind of living vicariously through their child and reliving their athletic dreams and putting pressures on the child that they haven't even put on themselves, but now they're there.
Yeah.
And then maybe they are also putting on these undue pressures on themselves because they are perfectionists. I'm speaking from myself here. And things that I dealt with. Yeah. And I don't think like my parents ever intended to do anything. And I don't think I had the parents that necessarily did that.
Sure.
But I did put these weights on my shoulder, and then sometimes the parents can be very overbearing. So is that a common thing that you feel like is a problem?
We see it a lot because kind of like you said, right? It's not like a direct pressure, like you have to be good at this, you need to do this. It's like, well, I can see dad really wants me to be good at baseball, and I am good at baseball. I don't want to disappoint, so let me practice harder, even though I don't really like this sport.
Man, I think we're gonna have a therapy session right now, Mike. Yeah. But so that's interesting, and so then you're as from your standpoint, you're now having to delve through these feelings with them because these are probably things that they haven't even been made aware of. Like, no, I like this sport.
No, well, I like baseball enough.
Right? Yeah. What else would I do? Because if you haven't had a chance to explore all of these other things, you don't even know what you're good at, let alone what you like.
Yeah. And you're kind of in a position where and it's not like in a pressure or a forceful way, you've been told what to do, right? Like, hey, I signed you up for baseball. It's going to be Tuesday and Thursday. Dad's going to take you. Cool, right? And it's not, hey, do you want to play soccer, baseball, lacrosse, or try golf, right? There's no choices. It's just, hey, I want to put you in a sport. I want to put you in something. Let's do this, right? And then they see dad super excited because dad's whole dream for having kids was to let them play baseball.
And I do think that dad's coming at it usually from a standpoint of like, this is a way of us to bond together too.
I loved this sport.
Yeah, I think that.
I hope they love.
And I don't want to make it seem like dads are just like, you're gonna be a pro. But I did have friends with those dads growing up. I did. But I think for the most part, at least the way I'm looking at it, is like, I would love my son to love baseball because that was my sport and that's what I can teach him the most.
Yeah.
And so there's bonding time for us. But I would never want to feel like you have to do. I generally want him to do whatever. And my daughters too. Whatever sport they want to do.
Yeah.
Like, I want them to just love it, right?
There's that common ground, right? So when just us as people, we, in any type of relationship, whether it's friendships, acquaintances, romantic relationships, we look for the common grounds, right? So we do that in all forms of our relationships. So why wouldn't we do it with our parents, right? Mm-hmm. The one parent that you're going to talk the most to about the sport is going to be the one that has that common ground and that common interest in the sport. Mm-hmm. If mom doesn't care at all about baseball or how to slide on your tummy, then we're not probably going to talk to mom about it. We're going to talk to dad, who's like, heck yeah, get down there, stay low, right? Versus mom, who's like, please don't rip your stomach.
And so then you're creating a different dynamic within that family unit too. That's not.
It just stems and it continues to grow.
Because then the mother needs to find their own thing to bond with them.
The own common ground. Because then what we really look at, especially with younger athletes and just teens and adolescents as a whole, is quality time, right? We have a lot of the family bonding. We have a lot of like, yes, we eat dinner together. Maybe we don't talk about as many in-depth things, but like, where's the quality one-on-one time? Where's the one-on-one time with mom, the one-on-one time with dad and other siblings and just everybody else within that family unit?
Yeah, and speaking from experience, it's definitely hard, especially once you're outnumbered and you have 3 kids. As our kids get older, we've already said we want to make sure that we have dates with each child, and my wife takes, and you have to plan these things and you have to strategize, and this is things that I talk to my clients about in dealing with consistency and building habits, and it's all stuff we know.
We know it. We just have to apply.
Sometimes need to push and need to just make the actual change. And so while you're talking again, it got me thinking back to, well, the initial problem was the specialization too early. So let the child have multiple interests and pursue music and whatever it is. It doesn't have to be sports. It could be anything. But and then it's nice if it's common with another caretaker.
Yeah. Hey, your Thursday's open. Do you we can play soccer, we can play tennis, we can learn the piano. Right. You can go to an art class. What do you want to do?
Yeah.
I want to play soccer. Sweet.
Let's do it. Love that. Okay, now let's dive further into, because this is stuff that's fascinating me. Like, when you have an athlete that for a fact loves that sport and has no pressure externally, they just want to be really good at that sport, but they're struggling on the field from not being able to handle that pressure. That clutch gene maybe not is there. So like, what do you kind of go through? What's the process? So an athlete comes in. What are the discussions that you have to have with them initially? And then how do you kind of go through the process with them?
So typically when I work with an athlete, I treat it the same as if it's an intake for a new mental health or therapy client. It's probably very similar to your intake, right? Like, tell me all the things about you. Tell me your history. Tell me any injuries. Tell me anything that you feel like is currently bothering you or currently something that we need to address immediately. Who are your emergency contacts? Talk to me about sports, relationships with coach. Do you have a medical treatment team that you follow on a regular basis? Do I have the ability to speak with them or your coach? And kind of like, what are you looking for in terms of, or why do you feel like you're coming to see a mental health consultant in sport? And for the most part, it's funny because we were talking about it earlier. A lot of it isn't the identification of like, my parent wants me to do this. There's so many external pressures. It's the internal pressures to succeed. And we can kind of go down the route of anxiety if it's a lot of just performance anxiety, or is it core belief based, right? That's where I typically start with every single athlete. Like, what are your core beliefs? Is it, if I fail, I'm a terrible athlete? Is it, if I don't show up to practice, I'm never going to play? And we kind of go down that rabbit hole first, because if we have really unstable core beliefs, we're never going to build off that foundation.
So you're finding like what that individual holds to be valuable. Yeah. Like, what are their values? What are their morals? What are they doing this for? And then you're diving further into, so I would imagine, depending on the athlete, depending on the sport, there's lots of different ways to attack this, different times of the game or whatnot. I know for me, as growing up being a baseball player, playing defense was something where super reactionary. You were out of sight, out of mind, and you just used your muscle memory of every rep you took, and you just made the play.
Yep.
But then you step on the other side of that field, and you're now a hitter, and you're thinking this pitcher has these types of pitches. He likes to start here. And you're thinking about more than I think the lay person outside of that doesn't know that sport. And I'm sure it's true for all sports, but that's when I did it in my own head and just second guess my own skill level in that way.
Yeah.
So for that, like, I always felt like I would be better at other sports where it was just purely all reactionary.
Sure.
There's nothing else to think about.
But it's like, is it all reactionary, right? From the outside.
Tell me
From
where I went wrong.
From an outside perspective, it absolutely does, right? Like you and I could, if you're a baseball player and I've been a softball player my entire life, and you and I go try to play golf and we love this, it's like, yeah, let's just whack the ball down the fairway. Is that really what it is?
No.
Probably not, right? We're looking at different setups. Are we swinging properly? The mechanics behind that, the speed behind that. Do we have the right club, the right ball? What's the wind look like? What's the distance? And, you know, for someone else outside of baseball, they're going to be like, the pitcher's hitting or hitting, right?
Right.
The pitcher's throwing a ball or a strike.
Yeah.
I'm just trying to hit the ball.
Yeah.
Right. So there's so much detail that goes into the specific dynamics of that specific sport that, again, if someone who you're working with doesn't understand that, on top of that, you're going to struggle with the professional and with the athlete, right? Bringing that back, I feel like when I take clients, I don't take clients outside of certain sports, and sometimes that restricts me, obviously, but there are also sports that I understand, and they're not sports that I'm not going to be able to talk to.
Well, and that's interesting. We've talked about this on a recent podcast with another one of our guests, where I think a strength in any type of clinician in either of our fields is knowing what you're good at and knowing when to send to somebody else. So what sports do you feel most comfortable treating?
Most comfortable with softball, baseball, golf, obviously CrossFit, some weightlifting. I've been dabbling a little bit more in running, not so much of like the long distance marathon runners, but more of like the shorter distance, just because a lot of running is a lot of mindset and a lot of the constant rumination of thoughts.
Which is kind of, I guess, what I'm thinking of too when we're talking about the baseball analogy or the golf. And then we're talking about general stress. I know for me that speaks, the rumination word is everything, right? It's this
for everybody.
Always, and that's the main thing. And if I can just clear the mind, then everything else is at peace, right?
So we think.
and so, how you mentioned we have to attack that core belief first. So it all kind of, you're really focusing on that the first several sessions before you're even getting to anything sport related,
because you have to believe it,
right? And so then you can start to move to how do we strategically turn things off on the field and just do what you know to be true.
And then you place those cues on the field, right? So it's short things. Like you can see it, the CrossFit Games this past year did a really good job highlighting a few specific athletes. And if I could find the footage, I would post it on the internet. But they take a clip of two different athletes and you can literally lip read the short cues that they are giving themselves. And it's the same thing that we do with athletes when they're on the field or they're in competition. And it can be something as easy as sprint fast, or it can be jump high, stay low. It's something, something so easy that they just continue to repeat to themselves and then go time.
So, and that kind of goes to, there's a lot of manifestation talk in today. And I think there's a lot of value in manifestation. Like we talk about visualization for sports, athletes, manifesting of like, I know for me, if I'm always negative, it's just going to pull me further down in that hole versus being grateful and showing gratitude and all this type of thing. So it sounds like that in its core is a lot of what you're trying to train the brain to expect good things and
Yeah.
think good things. And is that a lot of it, you think?
It's really easy to be able to be like, I missed that play. I should have picked up the ball. The sun was in my eye and I should have grabbed my sunglasses. I knew I was going to do that. It's really easy to find the negatives in all the things, but it's not really easy to be like, I almost got there. That was a lot better than it's been in practice. The short wins are still wins, and it's the same thing as on the field as it is in therapy, is recognizing the positive over the negative. And I think a lot of people think that sounds all puppies, roses, and butterflies, right? Find the positive and don't find the negatives.
Yeah.
But it's like, we do a really good job at finding the negative. Why do we have to keep finding the problem?
Yeah.
That's the easy piece. It's finding the things that continuously let us make progress, or that we've done successfully, and continuing to tell ourselves like, hey, we did this, so we can do this again, right? There's evidence there.
Yeah. And then just continue to fortify those patterns and make it to where you're not just telling yourself, you're actually, I honestly believe this because I know it to be true.
Yeah, it's creating another neural pathway, right? Like if you had an athlete on your table, you're going to say, you need to do these exercises to fire your glute and learn what that is, right? So do them 3 times a day, whatever, right? 12 reps, whatever. You're going to do the same thing with a therapy client or an athlete with sports performance, and talking about, you're going to find 3 positives out of your game or your practice, or just you doing dry land, or doing, I guess I forgot to talk about, I take swimmers too, doing dry land, or doing strength training in the gym. So you find 3 positives instead of your negatives.
So you're giving them like actual homework to assignments to go complete.
Yeah, they're writing it down. They're putting it in a notebook. They're bringing it back.
I think that's huge, because that's the one thing from my experience with other therapists has been, there's no actual change here.
Sure.
I'm just talking about it. So now I'm just ruminating about it.
Yeah.
You're not giving me any
Tangible.
successful tools, tangible things to work on.
Yeah.
And I think that's huge for the adolescent athlete especially.
Yeah. And there's definitely I understand everybody's in like the digital age where they're like, well, can I just use a notepad on my phone? No. You've kept a training log before. It's usually been paper, pencil, or pen on paper. There's something that correlates the brain and writing it down.
Yeah.
And it's so important that you continue to write it down versus just throwing it in a notepad. That when you write it, you tend to comprehend it a little bit more, which then makes you believe it more, right? So if your homework is to do 5 I am statements for affirmations for your core belief, and you're writing them down, and we have you consistently rewrite them for 5 days, you're going to eventually memorize them and understand them.
I believe that. That's really cool. And then I think a lot of this stuff sounds like things that, like I said before, maybe you intuitively know to be true. And you see these things on Instagram when you're doom scrolling.
Yeah.
Like, oh yeah, I should be more positive.
Yeah, be like a lion, and lions do that. Yeah.
But sometimes you need somebody to guide you through your specific things and give you, this is what you need to do. And that's what you do for your clients, which is...
You plug them into the real world situation, right? Like, you have a game on Friday.
Yeah.
This is what you need to do for that game on Friday. You know all of the things. You've been to all of the practices. And it's just setting up that routine for them that they understand and they continue to do all the time. And when you talk to a lot of like sports performance coaches, everyone's like, so you're just telling them to visualize, to say positive cues, to believe in themselves, to know who they are as an athlete, and to give them a routine of what to do pregame. Yeah.
Sounds like
but I want them to do that successfully.
Right.
And not just walk through it to walk through it. You can walk the walk, you can't talk the talk. If you can't actively do those things well and believe them, it's different than just running through them and checking them off the list.
Right. And then that comes back to the in-session, I'm sure, time with you.
Yeah.
Of breaking that down and having real conversations with yourself and being more self-aware of what you're actually feeling rather than suppressing things or not understanding things. And that's where you can help the struggling teenager. I'm sure it helps understand. So I love all that. Let's talk a little bit about CrossFit, because you're a CrossFit coach as well. You were just at the CrossFit Games last week, right? Tell me a little bit about the experience. I saw a buddy of mine from high school, Noah Olson.
Yeah.
Was he graduated the year after me.
Oh, that's.
And he's been second a few times, and now he's in the 35 to 39.
He just crushed the Masters.
He crushed it in one day.
Yeah.
Won it. So super cool. So how was your experience over there? Tell him like what was your role when you were over there?
So it was absolutely awesome and busy and crazy, but busy and crazy.
Tell from your Instagram story.
Busy and crazy in the best way, right?
Yeah.
So just kind of acclimating to California time alone was a little bit rough.
Right.
So this is the second year that I have come on CrossFit staff to contract as their mental performance coach. 3 years ago at the 2024 CrossFit Games in, I almost said Houston, Texas, in Fort Worth, Texas, an athlete had a heart concern and ended up actually passing away and drowning. And we were at that. Actually, Christina, myself, and some friends, we went as a vacation, which didn't obviously end up as vacation. And we kind of jumped in and did some crisis counseling and did some counseling with athletes, gym affiliate owners, just everybody that was there, any of the staff that was there.
It was a shock to the entire community.
Yeah,
It's very scary for the athletes.
It was extremely obviously unexpected, but it definitely shocked the community of CrossFit. From there, the company took me on and brought me on last year and this past year as their mental performance coach, along with a colleague of mine who unfortunately wasn't able to come with me this year.
So you're extra busy.
Yeah, so it was extra crazy. And we kind of cover a little bit of both, right? So for the athletes, we can kind of, for the athletes that are there, we can cover the mental performance standpoints if, there's some anxieties or some concerns or just want to kind of chat it out loosely. A lot of them work with their own coaches anyways, and they bring them with them. So it's not like an introduction meeting, but a lot of them I've personally worked with in the past, and it's just kind of nice to be chummy with them. And then also from the other standpoint of things, they do have two mental health professionals because we're both licensed mental health counselors that are on staff in case something does happen, and we can kind of provide services for staff, employees, anybody behind the scenes. There was a heart attack that happened in the arena or the area that the vendors were in this past year, and a couple of the vendors had seen it and they just kind of were a little shaken up, so we kind of talked to them before the medical professionals came out and just checked on them. But it's more of like the wellness team that CrossFit likes to call it, so it's a nice piece that they bring us on.
Yeah, I love that. And I guess I wanted to make sure we talked about this because I think this is really cool. Something that you do with your clients, especially your CrossFitters, is like the rucking. So
yeah.
What do you call it again?
Yeah, ruck and talk.
Ruck and talk.
Yeah,
right?
So we'll do walk and talks and ruck and talks.
Yeah, and so this is a way where you're coming to have your mental health session, and you guys are outside. It's maybe not right now when it's so hot, but in the fall, like in the winter, enjoying beautiful weather, getting a workout in, killing two birds with one stone. So yeah, tell me a bit about like why do you like that process?
So with the walk and talks, it can go one of two ways, right? So sometimes it's people don't like sitting across the couch from me and being like, so tell me more about that, right? And they're just kind of...
Although Sushi's there.
Sushi...
Her dog's there all the time. Like, come see Maggie.
Yes,
She's the one.
Well, now that Sushi's here, everybody just has to sit on the couch and no one wants to go outside at the point. But the walk and talks originated just because, especially for men's mental health, they really struggle to sit across from, especially a female, and telling them all of their problems. And this isn't me saying that this is a generalization or a bias. It's just what I've noticed is most men struggle to come to a woman, especially sometimes a younger woman, and telling them what they're struggling with. Yeah, what I've found helps is when you and I walk side by side and we're just kind of having a conversation like two friends. It's a lot easier for them to open up because they don't have to directly look me in the eye. And a lot of the times I can ask the hard questions and not directly stare at them, and they'll answer them probably better than they would if they were in the other room. A lot of times too, there's just that shared suffering feeling of walking along somebody, and then when we come back into the room and you take that vest off and you just literally let it slam to the ground, it's like that symbolic weight that you're carrying.
That's literal at the same time.
Yeah, and it's
cool.
I usually wait a couple sessions before I'm like, hey, so when you take that ruck pack off, and they're like, yeah, Maggie, we already know. We've already talked about everything. I'm not carrying it with me anymore. I'm like, I'm just saying. A lot of my clients have been really good about, like, when I try to plug in the whys to things that we're doing, they're like, we already know. I'm like, do you? Because I'm just going to say it anyways. The walk and talks, they are still happening, even though it is really hot outside right now. But both the ruck and talks and the walk and talks are really nice because I can gauge a lot from those situations as well. If you and I are walking side by side, but then you start to lead, you're probably anxious about something and you don't really want me to pressure you or ask you any more questions. If you're walking alongside with me, you're kind of synonymous with me and you're empathetic and you're understanding that I'm an empathetic person and hearing what you're saying, and it's kind of casual. But if you're dragging behind, I'm going to start asking questions about how do we feel energy wise, where's our depression kind of sitting, because that's what I'll typically see, or it's a kid who doesn't want to be on that walk.
Right. It's a whole nother concept.
Yeah.
That's really interesting. That I love that the symbolism and the literal weight off your shoulders type stuff.
It's pretty
and then, not to mention, she's putting her body on the line,
Yeah.
working out extra just for the good of her clients.
This is why you treat my traps.
There it is. She comes right over here. She goes on her walk and then eat all the traps, and she's good to go for another couple of months. Well, Maggie, this has been very cool. I appreciate you joining us. If anybody needs any sort of mental health provider, especially if you're an adolescent athlete, golf, baseball, softball, swimming, CrossFit, did I miss any? Those are special. Weightlifting, all the stuff. Come see Maggie. She's right here across the hall from us at the Leaf Wellness Center, just off of Florida Mining Boulevard, right attached to CrossFit Tailwinds. And thanks for having us. Oh, tell people where they can find you on social media.
They can find me on Instagram at TherafitWorks. They can also look me up from the therapy pages on Psychology Today by my first and last name. And we're still working on building a website.
Awesome. Well, thank you again for joining us, and we'll see you next time, guys.
Thanks for tuning in to the Movement Driven Podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.